Hello, everyone. We would like to thank you today for joining another session of Raising Strong GHP Kids. Today, we have a special guest presenter. Her name is Meredith Bigger. She is with the American Lung Association and is a health promotion specialist. She will be helping us discuss what is called Zyn. They're Zyn pouches, and she will be offering resources to tackle this new public health threat.
Good afternoon. Thank you so much for that introduction and for the patience of all the attendees here as we've been trying to work out some kinks. I'm having some difficulty with my slideshow and accessing my notes while presenting. So I am going to present the slides without the notes. And I would just like to say that at the end of the slideshow, I'm going to breeze through fairly quickly because we're getting a little bit of a late start, but at the end of the slideshow will be my contact information. And if you have any additional questions or information that you would like regarding Zyn pouches, nicotine pouches, or honestly, any tobacco or nicotine product that you would like more information on, please feel free to reach out to me. Also, if you have any questions about the programs that are available in Pennsylvania, I'm happy to connect with you after the presentation also. Okay, so the title, first of all, my name is Meredith Bigger, and I am a health promotion specialist with the American Lung Association. The American Lung Association has a contract with the Department of Health to provide tobacco programming and resources and education in North Central, which is our region, of course, South Central and Northeast PA. I am the only specialist in North Central, and it's a large area. So what we do is we partner with different organizations that help us bring the programs and resources to the community. Geisinger is one of our partners that we have been fortunate enough to work with for several years. They offer our signature adult quit program, Freedom from Smoking. We really appreciate the work that they do. Our providers oftentimes have a good, quote, good problem is that they are prepared to offer cessation classes, but there aren't a lot of people signing up. And while that might not sound like a good problem, it really is because the number of smokers and tobacco users has declined greatly over the years. Unfortunately, we are seeing a rise in other products because the tobacco industry are marketing geniuses, and they come up with new products that are more addicting and still just as harmful as cigarettes and traditional tobacco. So that brings us to our presentation today, which is about nicotine pouches. And the title of this presentation, Under the Zynfluence. This presentation was created by one of our experts. Her name is Jennifer Folkenroth. And I was planning to read through her slides, the notes, but I'm just going to go slide to slide and do the best I can here. So next slide, please. Okay, so first of all, tobacco, the introduction to some of the key terms that I'll be using. When I say tobacco product, that's any product containing nicotine from any source. Nicotine replacement therapy, which we often refer to as NRT, is an FDA-approved medications used to treat tobacco dependency that contain nicotine but do not contain tobacco. So NRT does not include e-cigarettes or nicotine pouches. Zyn is currently the most popular nicotine pouch brand on the market, but there are many others. Okay, next slide. All right, so commercial tobacco products. All references to tobacco and tobacco products in this presentation refer to commercial tobacco and nicotine products and not tobacco or other plant mixtures grown or harvested by indigenous people for sacred purposes. Okay. All right, so there you see an image, if you haven't already seen these products, of the Zyn nicotine pouches. They were originated in Sweden. It's similar to snus, which is a pouch of nicotine that delivers nicotine in a little bit less messy of a way compared to chewing tobacco. These products do not contain tobacco leaf, which is why they are often marketed as tobacco-free, which is deceptive. They do contain nicotine and other chemicals and fillers. Many of them contain flavorings and sweeteners, which is what the appeal is. There is no need to spit this product like with chewing tobacco, so it's neater and more discreet. They do not produce an odor other than maybe a sweet smell, no smoke or vapor. Nicotine is delivered directly into the bloodstream through the membrane of the mouth. And they can be used very discreetly at any time, anywhere, which makes them a real big concern for our youth and increases the dependency on the drug nicotine because you're able to dose your brain with them more frequently and consistently throughout the day. So tobacco-free products can contain nicotine by extracting nicotine from tobacco leaf using synthetic lab-created nicotine salts. Thank you. Okay, harmful effects of nicotine. I'm sure you already, if we have healthcare professionals on the call here, I'm sure you're already aware of many of this. And I was aware of a lot of this before I started here at the Lung Association, but I've learned so much more. Obviously, we know that nicotine is highly addictive. Addiction to these products can lead to combination use, dual use, where people are using maybe their primary product, nicotine delivery system is like an e-cigarette or another type of product, but this product allows them to not experience withdrawal symptoms and use the nicotine throughout the day, such as at work. Nicotine use can cause cardiovascular and respiratory issues. Nicotine use in adolescents, this was something that was new to me when I started working at the Lung Association. It's one of the reasons why I'm so passionate about sharing this information with schools, healthcare professionals, and parents, because nicotine use in adolescents affects the brain, primarily the areas that control learning, mood, memory, attention, and impulse. The last thing we need are kids who are moodier, have additional worsening problems with attention, impulse, and learning when they're at such a critical age for learning and making life decisions. Frequent nicotine use can lead to nicotine toxicity in children and adults. But there was actually a presentation that a colleague and I did in north central PA in one of the northern counties, and an area physician also joined our presentation, and she spoke to the fact that she was aware of somebody who had a child who got severely sick from nicotine poisoning by picking up, I believe it was an e-cigarette actually. So it's really dangerous to young children, not just youth that are intentionally using them. In 2022, a study of 44 nicotine pouches found that 26 of the samples contained cancer-causing chemicals. Okay, next slide. All right, so here are some of the flavors. Nicotine pouches, I'm sure you may have noticed, and if not, you'll probably notice now. Nicotine pouches are sold in gas stations, convenience stores, grocery stores, and online. Their flavors are attractive to kids. They cost around $4 a can, and you can bundle and get multiple cans for, a deal. These are some of the most common flavors. Okay, next slide. So this was one of the slides that when I was reading the notes, that there were a lot of statistics and information that was really interesting to me. So I thought that, it would be a real good one to focus on. Trends in adults. actually are showing that the majority of adults who use nicotine pouches are 21 to 24 years old, but over a quarter of individuals who currently use this product were 18 to 20. Current use was highest in Hispanic and white individuals, with use in Hispanic individuals following closely behind. Current use was more prevalent in southern regions of the country and lowest in the east. And I'm not sure if this will come up on the next slide, but there was a study done that shows the number of Zyn purchases do not correlate with the number of adults who report using these products. So that tells us that while sales are skyrocketing, adult use is not reflecting the skyrocketing sales, which tells us that a lot of the purchases are being made for youth by adults, because these products you are expected to be by law 21 or older to purchase, but we know better. Okay, next slide. Okay, so this was good. This was the slide that I was referring to. So few U.S. adults use nicotine pouches, this study finds, which again shows that the increase in sales means that a lot of these sales are being made for or by youth. A lot of the sales are made online, and while the law does say that an individual needs to be 21 to purchase nicotine products, including these pouches, the verification is very lax. It's basically, in most cases, just clicking a box saying, yes, I'm over 21. Okay, next slide. Okay, so trends in youth and adolescents. According to the National Youth Tobacco Survey, in 2024, 480,000 youth in the US reported using nicotine pouches, which has doubled from 2021. 1.8% of middle and high school students reported current nicotine pouch use. And unfortunately, it's difficult to identify when somebody has a nicotine pouch. They're extremely discreet. They're very small. You wouldn't necessarily notice them. And some kids are even using them in the lower part of the jaw and the upper part of the jaw. So they have multiple in at a time. Young people who use oral nicotine pouches are also using other products, vaping, or smoking or chewing tobacco, and then they substitute the nicotine pouches when they're not able to use their preferred product. Okay, next slide. So skyrocketing sales. Zyn is owned by Philip Morris, which I'm sure you recognize that name, the fourth largest international tobacco brand. Nicotine pouches expected to earn $2 billion in the US revenue in 2024. This presentation was created in 2024 mid-year, so we will have updated figures, in 2025 to make available. By dollar sales, Zyn represents 24% of smokeless tobacco product brands. Okay. So this shows some of the marketing. And if you look at the top right part hand of your screen where it says find your rhythm, that was actually taken by a lung association staff. I'm not sure in what part of the area that was taken, but it was a venue, a concert where it was clearly sponsored by Zyn. You have the marketing, of Zyn, professionals say that they don't market to youth, but they intentionally market at venues where youth will be present. So they're not working hard not to market toward youth. You will also see marketing on point of sale promotion at gas stations. Like I said, sponsoring events on billboards and well, not so much in television ads, but social media, most certainly. Okay, next slide. And the title of our presentation, Zynfluencers, is a term used by social media influencers who promote Zyn. So, many years ago when the tobacco industry was using celebrities to promote their products, that was a really effective way before we had social media and the internet. Now, social media influencers really have taken over. Obviously, we still have celebrities who are social media influencers, but we have just everyday people who are really driving this influencing done on social media. And a lot of it is being viewed by kids. Almost half of all TikTok users are 24 years or younger. And so that should really speak to the audience that social media and Zynfluencers are who they are reaching. Okay, next slide. Okay, so some slang terminology. I don't know how many on the call are parents, are here as a parent or here as a professional, and you're also a parent, but I know when my kids were teenagers, they a lot of times used words and phrases that I didn't even know what they were talking about. So we wanted to share some of the terms, and so that you're familiar, if you hear, you know what your youth are talking about. And some of these just make sense. An upper decker is when they have a Zyn pouch or a nicotine pouch in the upper part of their jaw, and a lower decker is in the lower section. And they call them lip cushies. And these are just some of the slang terminology that kids are using and influencers are using. Okay, next slide. Thank you. And these are some of the great ideas that they're promoting on social media. And obviously, I'm being sarcastic with that. Combining sugar and nicotine just to boost the impact. Caffeine and nicotine, obviously, also to boost the impact of nicotine, and alcohol and nicotine. Okay, next slide. And this shows the similarity between the tins, the icebreaker and the Zyn, and also that the marketing is actually encouraging Zyn users to collect the tins, comparing it to icebreakers and how kids used to collect the icebreaker tins. They're colorful. They have celebrities on the tins. They're just very obviously appealing toward youth. Okay, next slide. We have seen these marketing games and manipulative tactics before with e-cigarettes. It's the same playbook. It's just a new product. Both Zyn and e-cigarettes are tobacco products and must be authorized by FDA for sale before they can be sold. In addition, there are restrictions on marketing practices. Next slide. Sorry, I see we're at 12:30 already. So why can Zyn market like this? Under federal law, Zyn and other nicotine pouch products are, in fact, on the market illegally. However, the federal government has not acted to remove Zyn and other nicotine products from the market while they are reviewing the product. So make no mistake, these products are not legally marketed currently, but they are for sale. Okay, next slide. So FDA review status of Zyn, again, as of 2024 and now 2025, the application is still pending FDA review. In April of 2024, national organization letter to Brian King, director of FDA Center for Tobacco Products. Some of us came together, the Lung Association, American Academy of Pediatrics, the Cancer Society, American Heart Association, PAVE, which is a wonderful organization, the Truth Initiative, and wrote a letter to try to remove these products from the market until the review was completed. So that's just a copy of the letter. Next slide. Okay. And just as a recap, problems associated with current marketing and sales of Zyn. The product is marketed illegally. It needs FDA authorization before being sold. Nicotine is very addictive, and the product can be used extremely discreetly, which makes it more troublesome, particularly with youth initiation. It encourages high rates of dual use. It's not assistive in helping people to quit. It's offered in so many attractive flavors. There's a strong media presence, promoting the product, and false claims to effectively aid in smoking cessation. Again, that's not generally what we're seeing, and it is not an FDA-approved quit medication. Okay, next slide. At the Lung Association, we have a phrase, and our recommendation is to encourage tobacco users to quit and not to switch. So if somebody would say that they were switching to this product or e-cigarettes from a combustible or a traditional tobacco leaf product, what we recommend is that you are prepared with some information, facts and statistics, and quit resources to help encourage that person not to switch, but to actually quit. And in their quit journey, to use a combination of counseling, such as through Geisinger, the quit counselors. 1-800-QUIT-NOW is available and it's free. And also to pair that with FDA-approved NRT. Okay, next slide. And this is just a chart of some of the FDA-approved quit medications. They have long-acting medications, such as the nicotine patch and 2 prescription medications, and short-acting medications, nicotine gum, lozenge, and nasal spray. So what they recommend is that a combination is used, tailored to each individual, because everybody is different. And if you pair a combination of, say, a nicotine patch with nicotine gum, that way a person has a long-acting medication which are keeping the nicotine levels stable in their bloodstream as they're trying to quit. And then if they have an urge or they're in a situation that's triggering, then they have another line of defense, such as the nicotine gum or lozenge, to pop in so that they can feel like they're really targeting that craving well. And then, of course, the plan is to step down in dosage every few weeks until the person is completely off of the product, off of the nicotine. Okay, next slide. So again, how can you help? Educate yourself. Visit lung.org. Support and encourage individuals who use tobacco to enroll in one of our quit programs, such as at Geisinger, 1-800-QUIT-NOW. Encourage them to do their own research. Go to lung.org and look at, all of the resources and information that's available. And also, we have trainings on lung.org for healthcare professionals or parents to prepare you with facts and also information about resources that are available so that you're prepared to have conversations as you interact with your loved ones and or your clients who are using these different products. We try to stay up to date with the latest products. It's a challenge because the tobacco industry always seems to be a couple steps ahead with coming out with new and more addictive products. But what we all can do is be informed and try to be supportive with people who are trying to quit, and also to be informed to share information with parents and youth so that they don't initiate nicotine and tobacco use. Next slide. Okay, so these are some of the resources that are available on our site. there's a one-pager about Zyn that I'd be happy. I actually will share that out, and then you can access that. It's available on our website also. And I'd like to just refer you to the pyramid down at the bottom. That is our model for how we are ending, preventing new youth from becoming addicted to nicotine, and all of the health effects that follow that. And on our website, we have that training that's on that pyramid there. It's there's two actually. One is Ask, Advise, Refer, which is a 1-hour free training for people who work with adults or interact with adults who are using tobacco. And the other is called Ask, Counsel, Treat. And it's based on the Department of Health's Ask, Advise, Refer 3-step intervention, which is basically being prepared to have this conversation and assess tobacco use at every encounter with your loved ones or your patients, and then being prepared to share a fact with them. That's the advise. And then refer or connect them with the services that are available, such as quit services through Geisinger and also 1-800-QUIT-NOW. Okay, next slide. Okay. If you happen to see a violation where, say, you notice that something illegal is happening, such as samples are being given out or advertising is something that's a concern to you, you notice something that's really, the advertising is really directly targeted toward youth, which in our opinion, most of them are. But there is a way that you can report that. There's an online form. You can also call that number, the Center for Tobacco Products, and report it that way. There's an email address we've provided for you to snap a picture of illegal or very, manipulative marketing and submit that to the FDA. Change occurs when awareness is brought to the problem and enough people speak up. So please, if you see something, say something, as they say. Okay, next slide. And these are some of our references. Again, this will be made available afterwards if you would like to touch base with me on any of, there's Jennifer Folkenroth's email address. Mine is actually the same format. It's meredith.bigger@lung.org. And if you have any further questions or ideas or thoughts or anything that you would like to discuss, please reach out anytime.
Oh, Meredith, this was absolutely wonderful. And we just thank you so much for taking the time to present today. It was very eye-opening. And again, we appreciate you taking the time to share this with us.
Thank you so much.